sort of contemporaneous with the war. I was thinking of the lady antebellum, I guess is what I was thinking of. So I'm not going to ask you to understand the beautiful and remarkable histological organization of the cerebellum. I've got to have a couple of illustrations in here where you can see the relationship between the molecular, Purkinje, and granular cell layers. The cerebellum includes a variety of cell types with just delightful names: climbing mossy fibers, climbing fibers. Many of these are glutamatergic. There's a whole, we run the entire gamut of neurotransmitter systems. But once again, only a few of these types of cells actually send their axons, send their efferents to the integrating centers that lie actually within the white matter. The white matter consists of myelinated tracts, but there are at points in the CNS where you have these little islands, these little clusters of gray matter inside that white matter, and the DCN, the deep cerebellar nuclei, are such a thing. There's little islands, little shopping malls in the center of just out in the woods, and they're just sort of positioned there. So what I would ask, though, that if you see reference to climbing fibers, mossy fibers, spiny interneurons, you should be able to associate those cells with the cerebellum, and certainly the Purkinje cell of this sort. And once again, here you do see that beautiful organizational structure of the Purkinje cell. You see the dendritic tree out in the molecular layer, the cell body, and the one sometimes recurrent axon. We talked about the cerebellar pedicles. Don't confuse these with the cerebral pedicles. The cerebellum, as I say, functionally is just is very difficult to sort out. There's all kinds of active research on the cerebellum, and as you look at the organization here, you can see there's an anterior, posterior lobe. The anterior lobe, posterior, sometimes called the oculonodular lobe in here. The division of function. Let me just sort of say this because I don't want to I can sometimes get into this in more detail than necessary, but the division of labor, or the division of function in the cerebellum, is more along this axis, mediolateral, than this axis. And so here's all I would say about this, is that this region in here seems to be most involved with the analytical comparator, the correction of motor function and so on. That's that central region right here. Lateral to that, it gets awfully complicated. For example, do you know how to use the word lay properly in American English? Can everybody have a good handle on that? Can all of you conclusively tell me the difference between amiss and remiss, or any other term involving motion? What I'm suggesting here is what a lot of research is indicating, that the lateral regions of the cerebellum may be involved in cognition and cortical processing, your ability to, for example, select the right verbs. So a lot of interesting research about that, but it's the central region here that's probably the traditional motor refinement region. You don't have to worry too much about the specific pedicles. I have let's see, this is superior there, this is the middle, and this is the inferior. You don't need to worry about that, but that's what these are referring to here. All I want you to recognize from this slide is that the cerebellum is interconnected with virtually every other part of the brain. One peculiarity of that connectivity is that it is always ipsilateral. Anybody know what the word ipsilateral means? Same side. So in other words, how many times have I asked you, does the left brain control the right side of the motor function? Yes. Not true for cerebellar pathways. Cerebellar pathways are always same-sided. Can't tell you why. And so here you see some of the, you don't need to memorize these, of course, but this just illustrates some of the remarkably complex cerebellar interconnections between, for example, other parts of the brainstem, the cerebral cortex, the basal nuclei. By the way, these are the cerebellar nuclei that I've referred to here. So here's our trilaminar structure. This would be the white matter, and then these are the deep cerebellar nuclei that are actually taking that convergent information and then sending it off to these other parts of your nervous system. All right. As if the cerebellum was not completely too much for at least my little brain. I have trouble dealing with all these new discoveries with respect to cerebellar function. The basal nuclei are especially vexing. First of all, in most clinical literature, the basal nuclei are called the basal ganglia. So you should recognize that both terms are used. As you look at the frontal section of the brain here, you can see the right and left hemispheres. By this point, you should be able to differentiate the gray matter of the cortex, right, from the white matter, which is down here. So once again, most of the cerebrum is white matter. All right, but here's the deal. The basal nuclei reside, much like the deep cerebellar nuclei in the cerebellum. The basal ganglia or the basal nuclei are little islands of gray matter positioned within all of the interior white matter of the brain. Now, if you look up here in this little list, you can see the regions that you need to be able to associate with the basal nuclei, and in some cases you have an indication of where they're located. So, for example, let's talk a little bit about the anatomy. Here, this little bluish region here includes the putamen here and the globus pallidus here. So this is sometimes called the lentiform nucleus because, I don't know, somebody thought it was shaped like a lens. But in any case, the lentiform nucleus of the basal ganglia consists of the putamen and the globus pallidus. It looks as if we have a big strip of white matter separating the putamen from this region up here called the caudate, or the caudate nucleus. So everybody see what I'm talking about? Here's the putamen here. Here's the caudate nucleus here. And you can see the white matter, which was called the internal capsule, or at least traditionally called the internal capsule. That's now my favorite. This was the external capsule. There's the internal capsule. But the point I'm making is that it appears that the putamen and the globus pallidus are separated by a portion of the internal capsule. Current thinking is that's not true. And so really what we now think is that the putamen and the caudate are part of the same tissue, just separated by a creek. And that's important because the two together, and this is going to be a word you see in the clinical text all the time, the two together form the striatum. So it's really one, I won't say functional, but anatomical tissue. Striated implies what? Striped. And that's all it means. It's under the microscope. From a certain perspective, these tissues can sometimes have a striped appearance. All right, so make sure you are familiar with, you can identify those structures in a frontal section. And then down here, this is a little bit misleading. We talked about the substantia nigra. The substantia nigra is considered part of the basal nuclei, even though it lives in the midbrain, part of the brainstem. The nucleus accumbens is not shown here because it's a cholinergic, chiefly cholinergic nucleus anterior to the structures that you see here, but part of one of the dopaminergic pathways that we talked about earlier. We'll look at that again in just a moment. So bottom line, I want you to be able to identify or associate each of those terms up there, each of those regions of the brain with the basal nuclei. You don't need to worry about the subthalamic nucleus, but all the others you should be able to identify in a simple little slice like this. Now over here, this just illustrates the complexity of connections between the motor cortex and the basal nuclei. Remember, the basal nuclei is one of these three regions of the CNS that is responsible for regulating motor function. And we argued earlier that the primary motor cortex is going to be sending signals down to a skeletal muscle, but those signals are intercepted by the cerebellum, adjusted, and then returned. And similar sort of thing happens here, except I would argue that part of what the basal ganglia are doing is deciding before that movement begins, and before that movement is actually sent from the primary cortex to the skeletal muscle, the basal nuclei are involved in deciding which movements are appropriate. If you're going to perform a basketball layup, do you lead with your right foot or lead with your left foot? And you know you may be correcting that at the very last second. And the basal nuclei, once again, is integrating sensory information and helping you make that decision. Now, another important function of the basal nuclei is to initiate movement, unlike the cerebellum, which facilitates movement. In severe diseases of the basal nuclei, can you think of one? So coming up there on the next slide or so. The two primary diseases of the basal ganglia are Parkinson's disease and Huntington disease, and you get almost opposite results in those two cases because different tissues are involved, different portions of the basal nuclei are involved. But in the worst form, in the latest stages of Parkinson's disease, the patient can no longer move at all. They can no longer initiate movements, except under very interesting conditions. We've already talked a little bit about dopaminergic pathways. We know that we talk about a dopaminergic pathway that begins in, for example, the substantia nigra and then ascends into the basal nuclei and then goes on to the anterior brain. We call that the dopaminergic reward system. One of the curious aspects of Parkinson's patients, is that they seem to have just lost all motivation. In certain kinds of Parkinson, the patient they can feel hungry but don't have any interest in doing anything about it. And interestingly, however, if we have such a patient here and the fire alarm goes off, even though they would starve themselves to death, they will get up and with typical normal motor precision, get up and leave. And then they'll get out in the hall, away from the alarm, and they're back to where they were. Very curious. So there seems to be a problem, again, initiation of motor function, in some cases associated with or related to motivation to perform that motor function. Now, what we're looking at here, we've talked about this before, we've talked about these two important dopaminergic systems. The substantia nigra in the midbrain is filled with those dopaminergic neurons. What tends to happen with age and in Parkinson's disease is that you don't have so much cell loss, but the production of dopamine drops dramatically. So we talked about that in aging, for example. We don't lose cells typically in aging, but the cells shrink. The number of cells doesn't change all that much. Same thing happens in Parkinson's disease, for whatever reason, with age and with Parkinson's. Parkinson's in some respects is an accelerated aging of the substantia nigra. That pathway is diminished. So the nigrostriatal pathway in Parkinson's disease is no longer functional. It's dramatically reduced in functionality. We talked about the mesolimbic system, which is the fundamental reward pathway, sometimes called the ventral tegmental pathway because of its position above the midbrain. The tegment of the midbrain is the roof of the midbrain, roof of the ventricle. The tubero-fundibular pathway is not so important for our purposes, but this is a pathway, see it there, that regulates production of prolactin in the pituitary gland. I haven't recovered from yesterday yet, is the problem. But this is a dopaminergic pathway that regulates prolactin production. There it is right there, extending down to the pituitary. Famous case of a lady in Las Vegas. She was she liked the Vegas lifestyle. She was an elderly woman, and she got pretty interested in the casinos there, and she started gambling. And she gambled and gambled. She gambled so much that she lost her home. She gambled so much that she lost her husband and family. They had no longer anything to do with her. What if I told you that this woman was taking medications for Parkinson's disease? You see any linkage there? Yeah. The dopamine we talked about, for example, the perfusion of 5-HT receptors all over the place, and you start playing around with the serotonin levels in the body, you don't know what the systems are going to be affected. And certainly, while these dopaminergic pathways are primarily, or at least the nigrostriatal pathway is primarily motor, in the final stages of Parkinson's disease, there are also symptoms of schizophrenia, loss of motivation, dependence behavior. So all of these dopaminergic pathways are very, very important in a variety of central processing functions. So here's the little discussion of Parkinson. In Parkinson, with development of the disease, with progression of the disease, there's progressively lost movement. We sometimes talk about bradykinesia, going from for example, if we go back to, trying to think of a good analogy, and I guess I'm accused that my analogies aren't so great. But in both the cerebellum and in the basal nuclei, you have a profusion of what are called disinhibitory motor circuits. Disinhibitory motor circuits. Now, most of the motor signals going to the motor cortex, from let's say the basal nuclei, are signals like this. They are, in fact, the Purkinje cell sends out 40 hertz signals, action potentials, 40 times per second. That's its tonic excitation, and then based upon whatever stimulus receiving, it changes the frequency. All right. The basal nuclei are sending out a similar oscillation. All right. And so there are in the basal nuclei circuits to stop that from happening. Those are called inhibitory circuits. If you were designing this system, what neurotransmitter would you use to inhibit this? What? GABA, yeah. All right, so here's my inhibitory GABAergic circuit that now has stopped this movement, which is your tonic movement, your tonic motor movement from the basal nuclei. All right, now suppose that GABAergic circuit is no longer functional, or let's say that I disinhibit, I inhibit the inhibitor. So here's my inhibitor. This happens, all of your motor circuits have multiple levels of disinhibition. So here's my inhibitor. This is my GABAergic circuit. And now I'm inhibiting my inhibitor. I'm disinhibiting it. What's going to happen? Yeah. So what normally, I'm just trying to make a very simplistic analogy, what normally the basal ganglia are doing is it's inhibiting sometimes, it's releasing sometimes. It's inhibiting sometimes, it's releasing sometimes. But if that inhibitor is broken down, if that GABAergic circuit is no longer working, what's going to happen? You know, you're going to get a constant melismus or apoptosis like that. When anybody remember the initial surgery they performed on Michael J. Fox? Is that his name? All the celebrities sound the same to me. I don't know. But they performed something, and you tell me what it means. They performed a paladotomy. What would a paladotomy be? Yeah, they did. They basically went in there and lesioned a portion of it, because that's the portion, that's the excitatory portion. And so, again, a very complex circuit, simple solution, kill it, stop the movement. Now they use more refined techniques. They use what we saw, the little deep
Stimulation.
thank you, the deep stimulation. I need some deep stimulation right now. That's what I'm going to go out and get liquored up after class, and then I'll do it. Yeah, so in Parkinson, there's a progressive loss of movement. In Huntington's, because of different regions of the basal nuclei is involved, you get sometimes what is called flailismus or flailing. You get constant undesired motion. But you can also see that in Parkinson, depending upon, again, the specific pathways and the manifestation of the disease. In any case, I've listed some of the possible symptoms here. Resting tremor. Again, this is not like the cerebellar tremor, the type of problems you have there. Bradykinesia, slow movement, very typical in Parkinson. And they too could have a very characteristic change in gait. So, as we talked about, because these are dopaminergic pathways, these are involving all of these systems, it shouldn't surprise you that changes in personality, mental health, motivation, potential proclivity towards schizophrenia, all of these things might result. So we've already talked about this. Typically in Parkinsonism, there's progressive loss of dopaminergic neurons in the substantia nigra. And we've talked about, how, and this is the point I was trying to make. You should understand that the basal nuclei as an entity is predominantly inhibitory. It predominantly allows you to control and regulate gross motor movements. The cerebellum takes care of the fine movement. But we also say the cerebellum is excitatory because it's correcting on the fly. The basal nuclei are much more inhibitory. All right. So moving on, we can talk a little bit about the hippocampus. The hippocampus is again, another one of these C-shaped structures. You can see a portion of it down here, and it actually sort of forms a C shape like this, bilaterally symmetrical on both sides of the brain. And it was named, do you think it looks, there it is, there's an isolated hippocampus along with the dentate gyrus. It was named for its relation, for its similarity to a seahorse, because it looks like a little seahorse. So, that's how it was named. It, like the cerebellum, has a 3-tissue layer organization, which is unusual because, as we're going to find out when we talk about the cerebral cortex, most of the rest of the cortex, most of the other regions of the higher brain have a 6-layer organization. But this is phylogenetically older, and it's retained its 3-layer organization. Now, the hippocampus function, which you always want to keep in mind about the hippocampus in terms of its functional anatomy, heavily implicated in your ability to acquire and retain information, memory formation and retention. We don't think that it's a memory storage region. Rather, it seems to play a very important role in your ability to consolidate memories. Any of you psychology students know what do I mean by consolidation? I'm sorry? Perhaps. I think I take a very liberal attitude. If you want to, you can process the information any way you want to in here. But normally by consolidation, we refer to changing short-term memory to long-term memory, converting working memory to long-term memory. And we think that's the primary function of the hippocampus. Now, it's a little bit more complicated. Things are always a little more complicated. You probably remember, heard about HM. HM, I can't believe it's been this long since he passed away. It seems like it was only yesterday to me. Because he pretty much is responsible for everything we know about the functionality of the hippocampus. But Henry Molaison, he was, I think, as a child, was in a bicycle accident, and he had epilepsy after that. And then still in some cases, the therapeutic alternative was to simply go in there and ablate the regions of the brain thought to be triggering these epileptiform seizures. Trouble is, when they went in there and performed this procedure, they removed most of his hippocampus and the associated entorhinal cortex and so on. So HM was remarkable in that he had about a 15-20 second memory. He could remember what happened in his childhood, but he could not form new memories for more than just a few dozen seconds at a time. And so if you're talking to him, you might have to just keep constantly reintroducing yourself. Now, curiously, because of the way these circuits are formed, he could often improve on motor tasks, performing some a puzzle or whatever that involved movement of one object to another location, whatever, in a very precise way, but he would have no recollection of having done it before, and he wouldn't be aware that he's improving in that task. With respect to the organization, again, this is the hippocampus and sort of sagittal section here. Again, that C-shaped organization. Before we leave the topic of hippocampus, and that's sort of the purpose of this slide here, are any of you familiar with the studies about taxi cab drivers? I know they've done one in Philadelphia, they've done one in London. If you're a taxi cab driver, does a taxi cab lifestyle change your brain in any way? Yeah, you're constantly memorizing. In fact, maybe it's London. It has this very exhaustive test. You have to actually know every street in London that you use. They do not let you use a GPS. But what happens? The taxi cab drivers actually have larger hippocampuses than you or I have. The hippocampus actually gets larger the longer they drive the cab. Who would have thought it? Who would have thought that the brain could change shape? And there are many other examples of this, where based upon your activity, a region of the brain, many of you are probably polylingual, multilingual. That means that a region of your temporal cortex is thicker than mine because you have that ability. The cortex actually changes in its size. Yeah.
For the hippocampus on taxi cab drivers, does that result in something else shrinking?
Oh, excellent. So the question was, does that result in something else shrinking? I'm gonna talk a little bit more about this because my hippocampus is about the size of a pea right now. You may have to ask that question again. The simple answer is yes. But we talked about the fact we related the use of antidepressants to children who have depression and the consequences. If a depressed child, the hippocampus is going to be reduced in size. Again, something you think about, maybe impaired memory formation. When you perform cognitive tests, so the fellow that won the Nobel Prize recently, he was in trouble recently, but the fellow that won the Nobel Prize, I on the favorite team of them, discovered place cells. Do you remember this? I think it was announced about 3 years ago. Nobel Prize for the discovery of place cells in the brain. What are place cells? This is amazing. You actually have in your brain, in addition to a cell for Angelina Jolie, we can talk about that later, you actually have a cell in your brain that tells you where this classroom is in relation to the hallway out there, and where this building is in relation to the interstate highway. Your brain actually has this very topological, topographic organization. Those are called place cells. The man who discovered this won a Nobel Prize. And if that's true, it shouldn't surprise you then that the hippocampus increases in size because it is very much involved in your ability to localize yourself in space. The hippocampus seems to play very, especially in lower animals. A mouse is much better at navigating a maze than you are. Monkeys have much better short-term memory than you have. Chimpanzees, I should say. Chimpanzee can do much better on visual memory tests than humans. Again, because of the different allocation of resources. But the question earlier was about does it come at a price? Yes, and when you test general memory in these people, the cab drivers, what tends to be the case is that their memory for other types of events and motor function is reduced. So again, nature is very conservative with its energy and resources. Now we've made a couple references to the limbic system previously. What we should say about the limbic system, I guess, is that it is an artifice. It doesn't have any actual, I guess there's no way that I can go into the brain of a human or a mouse and say, well, that is the limbic system right there. Let's take it out and poke it and see what it does. Rather, the limbic system is an abstraction that we impose upon a variety of cerebral structures by virtue of their relationship. Now, as you look at the graphic here we have the olfactory bulb and the nerve in humans. Now, notice the anatomy. It goes back to, this is your hippocampus here. All right, so there are direct connections to the hippocampus. This large anterior portion of the hippocampus is called the amygdala. The amygdala is very, very important in your ability to emote properly. You have appropriate emotions at the appropriate time, that you laugh when you should, that you are mad when you should be, and so on. So notice this. Odors, smell, right back to the amygdala. Amygdala, hippocampus, memory formation. And you can see the proximity to the endocrine system here. This is the hypothalamus and pituitary gland here. What you're looking at is the anatomical substrate of the limbic system. And by the limbic system, we're talking about, let's say, we mentioned this earlier, you become enraged about something, and that rage, well, first of all, let's approach it this way. Does emotion alter your ability to remember things? All of you, okay, does it enhance your memory or impede your memory?
Well,
Or you say it depends, but can you be? Let's say you're driving down the road here and at an excessively high rate, and suddenly a baby carriage appears in front of you. You slam on the brakes, car goes sideways. Thank goodness you missed the baby carriage. It was only just it was a raccoon or something. It doesn't matter. But you go, you're just very excited. Your heart rate's up. Now, did that baby carriage enhance your memory of slamming on the brakes and the events to follow, or did it impede your memory? All right. Do we all? David says it impedes the memory. Anybody think it enhances your memory? Okay. What most of the research shows in humans is that probably if you get that afraid and excited, you're going to lose about 10, 15 seconds of effective memory. And then your memory afterward is enhanced. I used to work with a guy at USF who would study this phenomenon in rats. And you know how he inspired fear in his rats? He had a bag of cats. And he would throw the cat on top of the rat cage, and he would make his various measurements. He would have them do tests. And so I didn't really approve of his methods, and I ceased having any relationship with him. But you get the idea. He was testing memory in the presence of fear. And that seems to be the pattern. But I think, as has been suggested, there are probably a lot of factors involved in this. I just want you to be aware that however you come down, whatever the research shows, it's this anatomy that's the basis for the relationship between emotion and memory. And there's a lot of research to suggest that if you detach the amygdala is not there, there is overall impaired memory formation. Freshly cut grass. Does that bring back any specific memories?
Yeah.
Yeah. Why would that be? Probably you smell some, you may smell bacon that takes you back to when you were a child at a campground, something, I don't know. But it's the emotion and the memory. So this is the limbic system. Of course, all of this is connected with the hypothalamus, with the ability to change heart rate. Hypothalamus is going to be connected to the brainstem. So by limbic structures, the fellow who came up with this idea, Paul MacLean, is the same one who came up with the idea of the reptilian brain, the mammalian brain, and the human, the cognitive brain. So again, a bit of an artifice, I guess, in terms of formal neuroscience, it's not technically correct, but it does imply this relationship between emotion and memory. I borrowed a slide from, I know you don't have this slide, but again, here's the smell center. This is the cribriform plate here. And once again, you can see these pathways back to the olfactory lobe. This entorhinal cortex is where your place cells are located. So this implies a direct connection between odors and locations, your memory of locations. And then, of course, we can see the hippocampus and the amygdala here as well. Hippocampus and anterior amygdala. No, you don't have that slide. I was just simply pointing out. By the way, you actually do. It's in one of the anatomy slides coming up. So that's all I have to say about that. As you look at a sagittal section like this, at this point now, you should be able to identify all of the structures you see here. You should be able to identify the structures of the brainstem. You should be able to identify the thalamus, the hypothalamus, cerebellum back here. We'll talk about the regions of the cortex afterward. All right, let's move in. Our last little examination will be of the cerebral cortex, that large outer rind of the cerebrum. And you can see in the illustrations here that the two hemispheres of the brain are separated by this large furrow you see here called the longitudinal fissure. We've already talked about gyri and sulci. The gyri are the convolutions that you see there, and the sulci are the black spaces, in this illustration, the spaces between the gyri. Keep in mind the cerebral cortex, also called the neocortex, is just a very thin layer of tissue. A corpus has a more extensive cortex than you have, but the corpus cortex is even thinner than ours. The two hemispheres of the brain are connected by several bands or strips of white matter. These are usually called callosal connections, but in this case, the largest of these bands is the corpus callosum. And before we leave these illustrations, so you can see the right and the left hemisphere. By the way, as you look at the illustrations in this slide, top and bottom, I would expect that you'd be able to identify the anterior and posterior regions of the brain. So make sure you can note the correct orientation here. So these are the frontal lobes here. This is the parietal lobe back here. And the two are separated. The frontal lobes are separated from the parietal lobe by this large sulcus here called the central sulcus. Absolutely critical because it divides not only these two anatomical lobes, but it divides the brain into two functional halves. This is your motor brain. This is your sensory brain back here. This large lobe here is called the temporal lobe, important primarily for, in addition to certain types of mentation, important for processing of auditory information, lingual function, and so on, especially on the left side. And then finally back here is the occipital lobe, chiefly associated with the processing of visual information. If we were to lift up this temporal lobe right here, sort of peel it back and reflect it, there's another little lobe in here associated with the limbic system called the insula, I-N-S-U-L-A. But aside from that, these are all the lobes you should be familiar with. So pay attention to the longitudinal fissure and again this central sulcus. Now in this frontal section, you can see the cerebellum down here. We can see the two hemispheres of the brain. What is that thing right there? What is that septum called? This one right here. The falx cerebri. Yeah, the falx cerebri. That's dura mater. You can see this. What is that? Superior sagittal sinus. Good. And you can see several important gyri and sulci here. Is this the brain of a young person or an old person?
Young.
Everybody says young. Why do you know that it's the brain of a young person?
The sulcus are not so developed.
Yeah, you can see the gyri are right up there against the skull. The sulci are small. Inferior sagittal sinus here. You can see the white matter and the gray matter clearly articulated. Just want to make sure you see them, that these gyri and these convolutions increase the surface area of the brain dramatically.
What would be that little, that looks like gray matter on the left side there?
I'm talking about this,
Sorry, on the right side.
on this side. You're asking about this?
Yes.
Oh, that's probably just a portion of the ventricle. Yeah, depending upon the way it's sectioned and depending upon the isoformity of the ventricles, it's hard to know. So I talked about the central sulcus, and again, this is going to figure prominently in our story because I want to make sure you appreciate the functional significance of this dividing line right here. Separates the brain into two functional halves, the motor and the sensory. We're just sort of going to summarize and say this is the motor region, this is the sensory region back here, parietal lobes, frontal lobes, prefrontal lobes here, prefrontal cortex, and so on. You can see, in addition, well, let's see how can we approach this in the limited time that we have. I guess the way I would say this is the following. This is called this sulcus in this region. You can actually say sulcus here, then this whole little strip here involves multiple gyri. That's called the primary motor cortex. Remember, the primary motor cortex is the origin of the corticospinal tracts. Corticospinal tracts. And these are the actual motor pathways. These are, we'll talk more about this in just a moment, but the corticospinal tracts form the final common pathway responsible for contraction of skeletal muscles. All right, so this is the executor. That's a little, probably shouldn't use that word because this region is called the executive region of the brain. By executor in this case, I just mean that it's doing it. It's responsible for the final execution of motor function. By the executive function of the brain, what do we mean by that? Anybody familiar with that terminology? Your decision making, deciding what to do. So I guess here's my point. As we move from here to here, we have more abstract levels of motor function, planning, anticipation of the consequences of behavior. That would be in the prefrontal cortex here. Decisions amongst the alternatives, executive function of the brain. All of that resides in what I'm very generally calling the motor brain. But more abstract of here, actual movement here. When you think about what you're going to do for lunch today, whether it's going to be a Big Mac or a triple baconator, right? At some point you have to make that decision, decide how you're going to get to the fast food place, what logistics are involved, where you're going to eat it, and at some point you actually bring that thing up to your mouth and unfortunately take a bite of it. But that's what we mean going from prefrontal to primary motor cortex. Any of you have heard of the famous case of Phineas Gage? He was a railroad worker back in the 19th century. His job was to emplace the dynamite in the rocks so that the rocks would be blown away and then they could then lay down the track. And especially his job involved tamping, pouring the dynamite or whatever the explosive was into multiple parts into the depression or into the hole that was cut in the rock, and then tamping it down. Another one that he tamped a little too hard. And what happened is, as he was standing above his tamping rod, tamping down, the rod went entirely through his skull, took out his left eye, took out the left prefrontal cortex, and emerged in this region right here. Now, most of us would assume that this would be an immediately fatal injury. Not for Phineas Gage. He was a little bit disheveled. He was a little upset for a time. He walked to his doctor's doorstep, sat down, and waited for his doctor. But here's my question for you, as you can sort of survey the damage there. What would have been the consequences of this? Thinking about our functions, our general notion of the prefrontal cortex. Prefrontal cortex, important for executive decision making, deciding what you're going to do, anticipating the consequences of your behavior, deciding if there are going to be adverse consequences, and what will other people think of you when you perform those deeds, those tasks. All of this is going on in your frontal lobe, especially the anterior frontal lobe. Well, in the case of Phineas, as you can see, he wasn't quite the same.
Did it maybe become like unfiltered and just said whatever came to mind and never like said exactly what he was thinking rather than...
Yeah, I think you're right. The traditional interpretation, that there's a fellow that has a new book out who says that we made too much of Phineas, the story of Phineas Gage, because he apparently went to South America and was a successful stagecoach driver for a while. After this, which is all the more remarkable, because I still want you to think about what are the consequences of dramatic loss of prefrontal cortex. Somebody was asking about lobotomies earlier. What is a lobotomy? Anybody in here had a lobotomy other than me? What is a lobotomy? How did they do it? The fellow won a Nobel Prize for this. Hope maybe you're thinking maybe the Nobel Prize is not such a great thing. The fellow won a Nobel Prize for coming up with the lobotomy. And it was done in a variety of ways over the years. You know, you could go in there and surgically remove the prefrontal cortex, but most commonly, if they didn't go through the nose, how did they detach the prefrontal cortices from the rest of your brain in those procedures? No, didn't even have to do that. You just take a little ice pick thing, go right there behind your eye, add a little blade on the end of it. Once you got it in a certain depth, it would sever the white matter pathways between the prefrontal cortex and the frontal lobes. What was that famous movie with Jack Nicholson? One Flew Over the Cuckoo's Nest. Yeah. That'll be guaranteed to get you crying this weekend. You need something to cry about. There are many examples of this. So what would have been the consequence? Well, yeah, let's say a criminal has a neurological disease, either developmentally or congenitally, and has malformed or insufficient prefrontal cortices. Should they be held responsible for their crimes? Are they responsible for their crimes? You know, this comes up about every 5 years. Some court has to make a decision. So far, we hold, and you can think about this, we hold that regardless of the brain damage, the individual is responsible for their crime. I won't get into politics here, because you know we even put people to death with brain damage. But in any case, the general interpretation of Phineas' behavior was that he was more capricious. He couldn't hold a job for very long. He'd start one thing, stop, and then go off to something else. He was much more profane with his language. Just started cussing right and left. Bottom line, avoid tamping rods on railroads, I guess is what I'm trying to say. All right, we're out of time. So I guess what we can do then, we'll take a break. I'll take a break and then I can come back and open up